Hi, my name is Greg Fell, Director of Public Health in Sheffield. This is a situation report of the 20th of September. So, epidemiology first. Difficult to read what's going on, but in short, the case rate per 100,000 over 7 days is flat and drifting down slowly. So less than 300, and case rate in Sheffield is less than the rest of South Yorkshire, but all much of a muchness across South Yorkshire. Flat, kind of going up, going down, oscillating gently, and the trend is pretty much the same in Sheffield and South Yorkshire as it is in the rest of the country. Hospital activity is also mostly flat at quite a high level. The NHS is under pressure, there's no two ways about that. Ambulance pressure is quite high, and primary care pressure is quite high, and it's important that we that bear with GPs that are trying to provide the best care that they can. Nothing much is going to make an impact on that other than extending the vaccination programme. When we continue to do that, it's worth me saying that the rate of new vaccinations is fairly flat now. We've got to sort of equilibrium with about 73, 74, maybe 75% of the adult population fully vaccinated. So we're in that space where we've got equilibrium with the virus. And nothing much is going to make a difference other than extending the vaccination programme, which we obviously will do. Mixing from school and work, so people going back to work and people going back to school and or university, will push the rates up a little bit. We've seen that with schools, it went up a bit and is now settling. I suspect university restarts will be the same. So I think the circulating virus is picking off those that have chosen not to be vaccinated, and there are still a lot of you out there that have chosen not to be vaccinated. The Delta virus, the Delta variant is very, very, very transmissible, and it will find people, and some of those will sadly come to harm, particularly those who have chosen not to be vaccinated. It is never too late. As I say, the rate of first dose is now flat, and we do need to push that up a little bit. We are extending the vaccination programme now, working with NHS colleagues to get into the 12 to 15 age cohort. And so people aged 12 to 15 will be invited, and I'd encourage all parents to think quite hard about whether or not they choose to get their children vaccinated. The Chief Medical Officer published an opinion and a piece of advice to the Secretaries of State last week. I fully support, fully endorse the CMO's position unequivocally, no two ways about that. Probably worth, if your child has been vaccinated and you haven't yet chosen to be vaccinated yourself, might be worth rethinking, a natural opportunity to rethink whether or not I want to be vaccinated. So even with the amount of vaccination we have a high rate of infection, 10 times higher than it was this time last year, 10 times higher. If rates were this high this time last year, we would have gone into full lockdown. So that shows how much difference the vaccination programme has made on impact on serious illness and death. It's definitely fundamentally shifted that link. But we have a high rate. We have a high rate of transmission. We have a high rate of NHS and social care activity, as I say, not just hospital, although that is the obvious pinch point, but it's well beyond that. We could get back into the woods very deep, very, very quickly. It wouldn't take much. One, doubling of the circulating virus, and two, we'd be in very deep trouble very, very quickly. So whilst we all want this to be over, we definitely aren't out of the woods by a long stretch. Lots of people have asked me about what the trigger for Plan B is. The honest answer is I don't know, but as I say, I suspect it will be some combination of the NHS being in significant trouble, and not just COVID-related pressure, but all of the other stuff that will lead to pressure in the NHS. We're going into autumn. Autumn is usually a high pressure time for the NHS and social care. So the likely trigger for Plan B, as the Prime Minister has alluded to last week, will be something about the rate of cases high and the rate of increase in cases. And remember, they're 10 times higher than it was this time last year. So as I've said before, it can flip really, really quickly. What can I do? basic messages are unchanged, and you know I've said this before. Being fully vaccinated is by far the most important thing that we can collectively do. If I have symptoms that I think are COVID, get a test, stay at home, isolate, and particularly if that test turns to a positive test, a PCR test, isolate. Wearing masks in particularly indoor crowded spaces, washing hands frequently. How many of us carry hand sanitizer around with us? We should all get into that habit. So all of those things that will make a difference. Opening windows. I know it's getting towards autumn, but the weather's still pretty nice, so opening windows, allowing fresh air to circulate. All of those things will continue to make a difference. Our basic strategy and our basic response remains unchanged, and my basic ask of the people of Sheffield largely remains unchanged. I think we're fairly used to that now. Lastly, the COVID bus is out there. It's in the city centre this week. Thursday and Saturday it's at the Cathedral. Friday it's at Broome Hall. We're spending some time at the colleges, encouraging people to think about vaccination. So if you see the COVID bus out there, particularly around the city centre, go say hi, and they'll offer you any advice that you need. So obviously the big thing in Sheffield this week is the university's restarting. So Sheffield Hallam are welcoming students over the weekend just gone. My obvious message to anyone coming to Sheffield for the first time, and the one is you're welcome. Two, if you haven't yet been vaccinated, please do so as soon as possible. And there are a number of places that you can get vaccinated really quickly. We have the walk-ins at Longley and Darnall. You don't need to be registered with a GP. At all. You can walk in without an appointment and get vaccinated, and if you haven't done, please do so ASAP. Look for the Grab a Jab website for all of the other opportunities that you can get vaccinated in Sheffield.